to the April Waukee Legislative Coffee. On behalf of the Chamber, I'd like to welcome our Chamber members and Waukee residents to this coffee, and we look forward to hearing from our elected local legislators, State Senator Charles Schneider and State Representative Kenan Judge on state issues, and following, audience questions will be selected by the moderator. My name is Melinda Bain. I'm the president of the Waukee Chamber. And we have a government affairs committee that puts this coffee on 3 times during session. So we're really excited to have our legislators here and all of you as well. So a couple of items. We do have a videographer here. Natasha Sofin has been hired to record today's coffee, so it will be made available on our Facebook and on our website, waukeechamber.com, following the event if you're interested. I do want to thank West Bank for sponsoring today's coffee. Ashley is here, the branch manager from the bank, so you can raise your hand and wave. Yeah. And the Chamber is a nonprofit organization, so we really do rely on our business members to help sponsor, just to cover, the cost of the coffee and the donuts. So thank you very much for doing that. As well, I want to recognize some dignitaries here today. We do have a couple of Chamber past presidents. I saw Don Fraser, if you want to raise your hand, as well as Chris McClendon. So thank you very much for your leadership. And as well, we have our Waukee Mayor, Bill Peard, is here. Bill, if you want to raise your hand. Bill Peard is our mayor, and thank you for joining us. Councilperson Shelley Hughes is here as well. Thank you for joining us. And so thank you all for being here. At this time, please join me in welcoming our speakers, Waukee legislators, Waukee State Legislators, Senator Schneider and Representative Judge. Thank you.
Thanks, Melinda, and thank you to the Chamber, too, for hosting this, and West Bank and all the other sponsors for the Chamber. And thanks to all of you who are coming out today to share your thoughts or ask questions about things that are going on in the legislature right now. What I thought I'd do is just give a quick status update as to where things are in the process, talk about a couple of the global issues that are being discussed as priorities this year, and then turn it over to Representative Judge. Last week, yesterday actually, was the official deadline for the second funnel. And what that means is that a bill has to have passed through one chamber and passed through a policy committee in the other chamber in order to still be alive for consideration this session. There are a couple of exceptions to that, namely budget and tax bills. But for the most part, policy bills, if they haven't passed through one chamber and passed through a committee in the other chamber, are no longer alive for consideration this session. So some of the priorities that are still alive include, of course, the budget. That's always a big issue, as you guys know. On the Senate side, we're trying to be conservative with how we budget our spending.
Hello, everybody.
Hi there.
Where's that coming from?
I've been practicing ventriloquism. Thank you. I'm here all day. So the budget is one priority. Property tax reform is another priority of ours right now. There is a bill in the House. There's another one that's being worked on in the Senate right now. The Ways and Means chairs in both the House and the Senate are talking about proposals to move forward. I don't know if any of you have gotten your tax assessments yet. I think most people have. In Dallas County, they don't appear to be too bad. I think mine was a 2.9% increase, and I know it depends on where you live. In Polk County, as Randy Ripperger has been warning us for a while now, the increases were pretty significant. The highest I've heard anecdotally from anyone is 16%, and I know they vary across the state too. And people are starting to reach out to us and ask us for some help in knowing what they can do to appeal their assessment and knowing what can be done in order to better manage the growth of property taxes on people overall. So that is a big priority for us. The children's mental health bill is still alive. That has passed through the House and is in the Senate right now. We've been working with the House to finalize that bill. It's a top priority for Governor Reynolds. It's a top priority for legislators of both parties in both chambers, and I do see us getting something done on that this session. Future Ready Iowa is another priority. That is something that's important to the governor and to all of us on both sides of the aisle and at both chambers. Everyone I talk to in any industry tells me that they need workers. They need people in our workforce. And that's what we're trying to do with this bill. We're trying to help existing companies be able to help people enhance their skills to upskill for some of the jobs that are currently available. We have a big skills gap in our state right now, and that's something that we're trying to fix. We're also trying to bring people to our state from other states and keep more of our population that's here in our state after they graduate rather than leaving our state and going elsewhere. And one of my personal priorities has been the whistleblower bill that I filed earlier this session in response to some of the things that we've seen with the Waukee School District. The bill that I filed specifies that employees within a district can go to their human resources personnel and tell them about information or report to them issues they're seeing. That's not clear under current law, but that's one element of it. Another element is that there are damages set for someone who was fired in retaliation for whistleblowing. Damages are set at up to 3 times a person's salary and benefits. So that helps give people an incentive to do the right thing if they suspect something that's going on. Otherwise, they might not be willing to come forward because they'd be afraid that they'd be fired and not have any recompense if that were to occur. And then the final element of that plan is that it requires the public employee to notify the employees that there's an 800 number at the state ombudsman's office that they can contact to report whistleblowing or to whistleblow anonymously. That bill has been amended in the House to apply to all state employees, not just to local government employees. That's I consider it a friendly amendment. It's something that we'll take in the Senate, and I look forward to passing that and sending it down to the governor. And the last thing I want to say on that whistleblower bill, too, is that since I filed that bill, I've heard from one person who said that they did report information to the state ombudsman's office, but they didn't feel as though there was any follow-up to their claim. They didn't feel as though their complaint was even taken seriously. So if there is anyone else out there who you know who has had a similar encounter with the ombudsman's office, please ask them to let me know. And they don't have to tell me their name or anything like that if they don't want to. I can better help the situation with the more people I know who've had experience with that, whether it's an anonymous report to me or not. So why don't I just leave it there, and thank you again for coming. Look forward to your questions, and we'll turn it over to Representative Judge.
Thank you, Senator. And it's a pleasure to be here. I also want to thank West Bank and especially Melinda, too, and the Chamber for hosting this event and giving us the opportunity to take questions and to listen to your concerns. So I thought I'd just introduce myself a little bit for those of you that don't know me. My name's Kenan Judge, and I serve in the district of Dallas County, West Des Moines, Clive, and then Waukee. Senator Schneider is my senator, and he has 2 representative districts. So I'm one of the state legislators that work together with him. But I sit on 4 committees, Commerce, Economic Growth, Transportation, and then the budget sub that I serve on is Health and Human Services. So as Senator Schneider said, our policy work, for the most part in committees, are done. So we're turning our focus to the budget, and as all of you know, that we have to have a balanced budget before we can adjourn, which is a great part of the Iowa Constitution. So I look at these bills through four lenses: is on public education, access to affordable good health care for everyone, the economy and jobs, and then work with civility and compromise. Those are the four things that I look at every day and try to achieve. Those are priorities. I'm just going to touch on two of those and talk about affordable health care. Since we did pass our the budget for Health and Human Services out of the subcommittee, there is some good things in the bill, adding 29 field staff to Department of Human Services. Their caseloads are high. Training, and this is very crucial, training additional psychiatrists, physician assistants, and nurse practitioners, psychiatric nurse practitioners. For mental health in Iowa, we have to start where we have enough professionals to serve our state. So I was pleased to see that in the bill. I also tip my hat to the governor with her children's mental health bill. I was displeased in the budget that we didn't step up and fund it better. Structurally, we have a great structure passed in the House. I know the Senate is now working on it, but we need to step up and fund it as legislators. We need to find the money to fully fund this, and so I'm going to be looking at that process throughout the rest of the year. The second area I want to touch on is economic growth. I spent 38 years in business, so I think that gives me, as a first-year legislator, is how can I fit in and best serve the state? And I think that's where I think I can bring to our caucus, at least in our group, a different lens and look through things through business. We had a great, and Senator Schneider did mention this about Future Ready Iowa and the growth of our economy. That's something that concerns me in the future. Is our economy is not growing like the rest of the country is. I think we have about a 1.5% economic growth. So for us to afford the programs that we need, we have to get this economy going to bring a better tax income into the state. Obviously, we're not for raising taxes, and we shouldn't be. I mean, I think we already have enough taxes. But we have to get this economy moving. So I heard a really good presentation in one of our economic growth meetings about housing. And we talk a lot about jobs and making sure we have good paying jobs. And that is a big need in our state. We need more good paying jobs. But in order to get them, we have to look at housing. I'm just going to give you we need a roadmap for affordable housing. Typically, 30% of your salary goes to houses, a home, where you live. So I'm going to tell you, 25% of our 1.4 million houses were built in 1939 or earlier. And there's a lot of older homes that are very well kept up, and especially here. But if you look around the state, we have a lot of houses that we need to redevelop and get more for workers. So if you're trying to start a business in a small rural community, you have to have the housing. And I know of several communities that are struggling with that. So we need to rehabilitate older homes. We need more senior housings to open up more housing that seniors are in their own home still, but would go to a nice senior housing if they had the option. So in the next decade, we need to get a roadmap working together with communities to have housing, affordable housing in this state so we can jumpstart this economy. So I'm just going to touch on those two things today. I will touch on civility and compromise. I'm enjoying my time at the legislature and, working together. We have a great senator here, Senator Schneider, that always will listen to you. We don't necessarily always agree on every item, but at least he'll take the time to talk to me. And it's nice having that conduit to the Senate that I can walk over there at any time and learn or ask him a question. What do you think about this? Where are we going with that? So those are three areas I just wanted to end with, and then obviously turn it back to Melinda if she had questions. Oh, okay. Are you gonna take the questions today?
I'll take the questions. So, if you would please stand up, state your name and where you're from, and I'll hand you the mic so that they can get it recorded. Who's first? Let's not be shy. Raise your hands.
Good morning. I'm John Twertis, Waukee resident. I'm also president and CEO of Lutheran Services in Iowa, which is a statewide social service organization that provides child welfare services, mental health services, services for people with disabilities. And I wanted to begin by thanking each of you. Back in February, I had the opportunity to meet with each of you at the State House and talk about a really significant problem we were experiencing with our ability to collect for the services we provided to Medicaid recipients and the problems we were having dealing with the managed care organizations, particularly United Healthcare and AmeriHealth. And I just wanted to let you know that the action that spurred from each of you really helped significantly in reducing the size of our problem. So we've collected hundreds of thousands of dollars in the last 2 months that we were owed, and for that I'm very grateful. One other thing I wanted to remind you of, we also had the opportunity to speak about the implementation of the Family First Protection Services Act, which will be implemented in July of 2020. And I had the opportunity to attend in February the Joint Health and Human Services Appropriations Subcommittee hearing, where the Department of Human Services presented their plan for that. You might recall that in addition to the increase in staff for the department and their information technology request, there was also a group there called the Coalition for Family and Children's Services in Iowa that reminded the legislature of the need to invest in funding for evidence-based practices for the 25 member organizations that make up that group. And that was a $10 million request. So I hope that as the Health and Human Services budgets unfold in both the House and the Senate, that you will be cognizant of that request and the importance of making the implementation of Family First effective. So thank you very much for your support.
Thank you, John. I don't know if the if that funding or what level of it was provided in the House budget bill. They're starting the Health and Human Services budget this year, but I'll check on that on Monday, and I'll talk with our budget chair for Health and Human Services in the Senate as well, and make sure remind him about the request and try and get from him an idea of where he is in that process and get back to you. You're welcome.
Good morning. Flora Schmidt with the Iowa Behavioral Health Association. I live in Waukee. I live in, I'm sorry, there went my pen whipping at somebody. It's been a tough week up on the Capitol up there. Funnel Week's been tough for a lot of us. On the appropriations side, House File 766, which is formerly House Study Bill 253, that is the House Appropriations Bill that Representative Fry put forward. We obviously are disappointed that there is not the funding in there, as was mentioned, for the Family First, but also on the substance use disorder side. But more concerning is a division that was put in the back of the bill, and it's Division 8 on page 63. And it basically says that the director of the Department of Human Services and the director of the Department of Public Health need to come together and make a plan to move the Bureau of Substance Abuse out of public health and move it over to DHS. Right now, there's not a need to do that. These two divisions work very well together. I represent mental health providers across the state as well as the substance use providers. And to suddenly try to make this change, the state's already looking for money and funding to move them over. We do not need to be next to the payer source of Iowa Medicaid enterprises because substance use is not funded by Medicaid for the most part. So we're asking that that part gets stricken out of the bill or turn it into a study that just needs to look at the feasibility of it. We're doubting that there's any financially good reason to make that move at this point. So we just want to make sure you're aware of it. And right now, let's focus on getting Medicaid working the way it is. We all got a shock just over a week ago when United Healthcare is leaving the market. We don't have Iowa Total Care up and running yet until July 1st. There's enough going on without trying to dismantle a bureau that is working very effectively. Thanks.
Yeah. No, thanks. Yeah, go ahead, Ken.
Yeah, since that's, I can answer that. I don't know if I can answer that question. I can at least talk to you about it. That's one of the reasons in the bill that I did not support it and voted no. I think we have room. We still haven't passed it in the House yet, and we're going to be making several amendments to that bill. There was a lot of great things in that bill, a lot of good things, and the money is balanced. But this is one of the areas I think that shouldn't have happened. Substance abuse in this state, we do not have the infrastructure we had 20 years ago to help people with substance abuse, alcoholism, drug abuse. And I think it's costing our state more in the long run. So to try to dismantle that piece of it, in my opinion, you're correct. So we are just now starting on the House side to talk about amendments of the bill. And we can reach out with Representative Fry, who will talk to us. He's a good representative that will entertain, and you can talk to him, and we'll try to get something done. I can't go ahead. I'm sorry.
I was going to add to that. We did meet with Representative Fry on Wednesday up at the Capitol, and yesterday we did submit to him a letter based upon our meeting along with 3 recommendations of how that could be amended, either to change the course, which I know he's not in favor of, and move. If you want to move something and bring them together, let's bring it over to the health side of the equation, or let's strike it out of the bill, or let's look at some kind of a virtual opportunity and turn it into a study.
Yeah, and if you wouldn't mind sharing that with me as well, I could talk to him Monday and our ranking member as well to see what we can do, and then I can report back to you. But on the, I can't promise you anything, but we still have to vote on that bill yet. So we do have in the House side, we do work together quite a little bit now that our chamber is really getting pretty tight. I mean, it's 46 Democrats, 54 Republicans. And so it does offer some compromise, and like I said, I can't promise anything and on that, but at least I can. If you'll give me that information, I'll talk to Representative Fry and our ranking member. So I don't know if you have anything on that.
Yeah, I was going to ask you to send it to me as well, Flora. Have you met with Senator Costello?
We tried. He wasn't in.
Okay. Well, if you wouldn't mind sending me that letter too, I'll make sure to talk to him, and I'm sure you'll be up at the Capitol next week too. And if you have any issues getting in touch with him to meet with him about this issue, let me know. Thanks. You're welcome.
Good morning. My name is Mary Ann Mickelson. I'm from West Des Moines, and I have a totally different question. What does Iowa have to do to stay on daylight savings time? We have states that have one time all year round. It costs a lot of money to businesses, to people, going back and forth of the time change. So what do we have to do and I think if we really take the initiative, I think our border states would party up with us. I really do. I think they'd partner up with us.
Thanks, Marianne. It's not an issue that's gotten a whole lot of discussion at the Capitol this year. But every once in a while it does. Every once in a while someone will file a bill about daylight savings time. And my guess is that there would be a lot of pushback to unilaterally changing anything in Iowa by our border communities. You got people in Council Bluffs who work in Omaha, and you got people in the Quad Cities who live in Iowa but work in Illinois. Same thing in Dubuque with Wisconsin. People in northern Iowa and Minnesota, people in southern Iowa with Missouri, Sioux City, and South Dakota. So I think if anything were going to happen with that, I would think that Iowa and all of its border states probably would need to move at the same time. That's just a hunch, though.
And I can mention that on the House side, too. There was some conversation over there. A bill didn't even get filed to my knowledge, but the pushback over there were kids getting on the bus in the dark was the pushback.
We'll just pick a time and stay with it.
Yeah, exactly. Yeah.
Steve Herwig, I live at Edgewater, the West Des Moines side of Dallas County. Two things. One is proposing legislation that's kind of in search of a problem. To wit, the voter ID law was originally promulgated on the idea that there was a lot of fraud in elections, and that was found not to be the case. The second example is the going after the recipients of Medicaid and having increased reporting activities. The cost of this in the second year was going to be $12 million, not to minimize the amount of effort that this was going to cause for the recipients of this. So I give great credit to the representative, the Republican representative on the House side, who didn't give a hearing on it because the people told her the amount of fraud in the Medicaid system is minimal. So we were going to come up with a program which I thought was mean-spirited, kicking people at the lower end of the spectrum, and the problem wasn't there, and it was going to cost $12 million, so I applaud that. The third point I'd like to make is Governor Reynolds, in her State of the State address, was trying to make restoration of felon rights one of her key proposals. So the legislature has known about this since January, and it's sailed through the House with near unanimity. I think there was only 3 votes against it, and it gets to the House side to Senator Brad Zahn's committee, and it's going nowhere. So I'm disappointed that they've had 4 months to discuss and think about this issue, and that they can't come to some resolution. So it's being postponed. I realize the legislative session is 2 years long, but I think it sends the wrong message. I think restoration of felon rights, we're now at the bottom of the ladder with Kentucky. I don't think we want to be there, and I think it sends a bad message, and it makes the Senate, quite honestly, look like they're way behind the time with their timetable for moving legislation. Thank you.
So I'll talk about those. Voter ID, that's, that law was passed 2 years ago, I believe, and is still being implemented. Medicaid validation, the fiscal report was reduced by the time the bill was brought to the floor. And what we were trying to do with that bill wasn't anything mean-spirited. We think it makes common sense to make sure that people who are receiving Medicaid benefits are eligible to do so. The process for doing that right now is that, my understanding of it anyway, is that DHS hires a bunch of people to manually call people and ask them whether or not, ask them certain questions to determine whether or not they're eligible for Medicaid. That is very labor intensive and very time consuming. Most other states utilize a third party like ADP or some other third party to look at information from a database and determine whether or not someone is eligible. It's a much quicker process, it's an accurate process, and in the long run, I think would save money because we wouldn't be, which was not reflected in the fiscal note, because instead of having a team of people manually calling, we could shift those employees to other uses within the department if needed, or maybe we wouldn't need those positions anymore. But we'd be able to use the third party to do that instead, which would save taxpayers money. I have heard from providers, dentists in particular, who do question whether or not some people that come into their offices are actually eligible for Medicaid. And there are cases of people who are on Medicaid in 2 different states. That this is, from what I've heard anecdotally, people from Illinois will come into some of the border communities in Iowa, and be registered in both states. Another bill we passed this year to try and get after Medicaid fraud had to do with criminalizing people who were found with multiple sorry, this wouldn't be, I don't think this would be Medicaid fraud, it's SNAP fraud. People who have, the way people defraud the SNAP system is they'll get multiple SNAP cards. So if someone is stopped and they have like 5 or 10 SNAP cards on them, then they're obviously not all theirs. They're belonging to other people. And we made possession of multiple SNAP cards a crime. And that was at the suggestion of a Democratic senator, Senator Kinney from Johnson County. He lives around Washington, Iowa, I believe. So what we're trying to do is just make the system better and more efficient. Regarding felon voter rights, I think it's good that we're having this conversation. And just because it didn't make it through this funnel deadline doesn't mean that the issue is dead. As you mentioned, Steve, a General Assembly is 2 years long, and I think that we ought to have some kind of enabling legislation to go along with the constitutional amendment to specify when someone is eligible to automatically have their voting rights restored. Is it after they've paid restitution? Is it upon release? Is it upon completion of a community program? Whatever the criteria are, I think it is important that we know what that is before we move forward with it. Florida, for example, passed a constitutional amendment automatically restoring felon voter rights, and only just now we're starting to have a conversation about when that actually takes place. That leads to court challenges and lawsuits, and we can avoid a lot of that if we do this the right way, if we do it thoughtfully and deliberately, and that's what we're trying to do.
I can speak to that too a little bit, Steve, on both of those points. I think the voter ID law, to me, was not needed. We need to find ways to get more people to vote, and I'll give you I always like to bring it back to people that I talk to, and I went to a nursing home here in Waukee and talked to a resident there to get an absentee ballot. And for us to do that, he hasn't driven for 10 years, didn't have an ID. For us to get him an absentee ballot, I had to call the auditor's office and said, you know, this person has an expired driver's license 10 years old. They did take that, and we did get him his ID. But I think we got to look at all these consequences. And from what I have been told, we didn't have a big voter problem in Iowa, fraud. So I would tell you that I would agree with you on that. The Medicaid increase to reporting activities, I think we always have to keep mind for the people that don't have the resources to do all this paperwork. We're putting a big burden on them by making them report in, and if they don't have the resources to do it, the people that can help them get through it, it's a major problem for them. So we always have to be aware of that. Obviously, I don't want somebody that's abusing the system, but I would say it's pretty small percentage-wise. And then the point on Governor Reynolds, I do applaud her for wanting to get this done, and it needs to be done. We need to correct it. The reason it did fly through the House with, I think, 3 voting against, and the 3 that I talked to that voted against it was because we didn't have it defined out with what Charles said. How is it going to go forward with we didn't have it defined well enough. So I hope we can get it done next year. I do think it should have had a committee. It should have been passed out of committee in the Senate to have a larger discussion on it. My guess is the votes aren't there to pass it. So, and that's a bad vote to take. So thank you for your question, Steve, and that's just my perspective on it.
Thank you. Ken Smith and Clive. Before I address the issue I want to address with regard to voter rights and other kinds of rights, one of the things I have a concern about is responsibilities. Felons ought to have the right to vote once they've proven they want to be a responsible citizen. How do you do that? That's, I think you were referring to that just because somebody's term served their time doesn't mean they're going to be a good citizen again. And I think that's probably one of the concerns here, just like people getting support financially for children and all that. There's rights and there's responsibilities. We ought to educate people about how to do so. A person in a nursing home and a 10-year-old driver's license, a more important question is what you did is, how do we make sure this person has what they need? The citizen has a responsibility. If they want to exercise a right, they have a responsibility to know how to do that. The issue, however, that I want to ask you about is the judicial reform. I haven't heard much about that. I'd like to see a little more about that. If you could address that.
You want me to start?
It's up to you, either way. Go ahead.
I can't, 'cause we passed it through the Senate. Yeah, I'm happy to talk to you about that, Ken. Judicial nomination reform is an issue that I initially approached with some trepidation. Once I looked into it more, I thought that it was something that was worth pursuing, and here's why. The process that we have now is, as you guys all probably all know, there's a judicial nominating commission at the state level, well, really for all levels of courts, but the level that gets the most attention with the bill that we passed in the Senate is for the Court of Appeals and the state Supreme Court. And there are a few things in there that I think could be done better. One is determining who the chair is of the nominating commission. The commission currently is made up of 8 lawyers who are elected by members of the State Bar Association and 8 gubernatorial appointees. The chair of the Judicial Nominating Commission is the most senior Supreme Court justice who is not the Chief Justice of the Supreme Court. As I was studying this issue, when I talked to members who have and who currently serve on the Judicial Nominating Commission, who also are bar elected members of the Judicial Nominating Commission, they expressed to me concern of potentials for conflicts of interest between members of between the bar elected members and the court judge, because sometimes the court justice is very kind of heavy-handed. They have a lot of influence in determining what the rules are for voting on people to be recommended to the governor and on process. Sometimes they will make direct recommendations to committee members for what type of process to use. For example, do we vote for 3 people at one time, or do we only vote for 1 person at one time? Well, whichever method you choose can have a factor in who ultimately is recommended to the governor. And lawyers may feel an undue influence to go along with the justice's recommendation, even if they don't necessarily agree with it. So I think it's important to do what we did in the bill, which is to let the nominating commission elect its own chair, rather than to automatically make it be the most senior justice of the state Supreme Court. Another issue is that the bar elected members are really a largely homogenous group. They all practice in the 6 largest cities in the state, so there are no lawyers who are county seat lawyers, no lawyers who live in small town Iowa and deal with average everyday people on a regular basis. Not that the other lawyers don't, they just don't live in small towns. So, yeah. So they just don't live in small towns. Also, all of them are litigators. There are no patent attorneys. There are no business attorneys. There are no derivatives lawyers. There are no in-house counsel. So it's not very representative of the legal community at large. And I think that it should be more representative. And the bar hasn't come forward with any recommendation to make the bar elected members more representative. So the bill would hopefully do that by letting the lawyer members be selected by the governor and by legislative leadership in both chambers and from both parties. So that was the second issue. And 6 of the 8 are Democrats. And they historically have been. I actually did a newsletter article on this that you guys can find online. I'd be happy to send it to anyone here if you want to see it. But if you look at history, the vast majority of the members are Democrats. There's one Republican on there right now, one independent. So it's largely skewed toward the Democratic Party. By moving toward the system that we laid out in the bill that we passed in the Senate, each party will always have a minimum of 4 members on the 16-member commission. So it's more fair to both parties. It also takes politics out of the process because it does away with Senate confirmation. The Senate confirmation process is a very political process by nature because the Senate is deciding whether or not to confirm an appointee. So that process is taken out of it. I think there was one more point I was going to make on that, but it's escaping me now. One, I know there are a lot of arguments people have made against what we did. One of the big arguments is that it injects politics in the process. And as I just argued, I think it takes politics out because it does away with Senate confirmation. I also think the other argument that I've heard made against it is that we have a great judiciary already, and people will point to the U.S. Chamber of Commerce ranking of judicial systems. Well, that's true. We do rank well. But so does Connecticut. And the process that we laid out is very much like the state of Connecticut's. Iowa ranks 13th in the latest Chamber's ranking. Connecticut ranks 16th. But Connecticut ranks higher than Iowa in trial judge competency and in appellate judge competency. This is information you all can find just by Googling U.S. Chamber legal system rankings. So I don't think we will be deteriorating our quality of the judiciary. I think it will stay the same, potentially even get better.
That bill is in the House now. It hasn't come to the floor for debate yet. I would take a different viewpoint on it respectfully, that I would vote no on that bill. I believe that any time we look at changing our judiciary system, we need to take our time and look at this at much, much deeper level. To me, in my opinion, I think you can disagree and still be civil, but I believe that it brings more politics into our judicial nominating system. And what my biggest fear is that it'll swing the courts to either being too conservative or too liberal. Today, the governor, and whether you're a Republican or a Democratic governor, you have 8 votes. And in the last 2 administrations, there have all been Republicans, and that's political, which I understand it'd be the same way if we had a Democratic governor. The problem I see is that when any party that controls that House and Senate are going to be picking, and if it's all Democrats, we're going to swing too far to the liberal side. If we go too many Republicans, we're going to swing too far to the other way. So to me, I think it's a dangerous bill to pass. It's not been on our calendar yet. I don't think the votes are in the House. I'm not saying that bill won't go through, but it's one that is going to be very interesting. It's been sitting over there for a long time, hasn't it, Charles? I mean,
Yeah,
you guys
it's been over there. We passed it a few weeks ago.
a few weeks ago. So, obviously I'm not privy if they have the votes to pass that, but we'll see. So we'll see how it goes to the rest of the session. So.
And if I could, were you done?
No, yes.
If I could just tack on to that, it's already political, and it already swings to the left. When Governor Branstad took over as governor, when he beat Senator Culver, it took 6 years before there was a majority of Republicans on the Judicial Nominating Commission. And that's because the lawyer-elected members are always heavily Democrat. They always skew Democrat. if Hubble had been elected last November, he could have a majority of Democratic members on the commission this year. So that's not fair. And having the way that it changes it so that the members are appointed always ensures that the minority party has at least 4 members on the Judicial Nominating Commission. Always. That is not the case today. And that's why it took Branstad so long before he was able to have a majority of Republican members on the commission.
Two observations. One, over the last 16 years, 8 controlled by Republican governors, 8 controlled by Democratic governors. The total number was 44 Democrats, 7 Republicans, and 9 no party. The mic's not on, is it? I don't think the mic is on. Oh, I'm sorry. I said over the last, what did I say, 16 years, we've had 44 Democrats, 7 Republicans, and 9 no party nominated by the attorneys. And that's 8 years controlled by a Democratic governor and 8 years controlled by a Republican governor. The other thing that nobody's addressed and I think is a valid consideration is the reform also interjects consideration of sexual base of the attorney. Right now, most of the people are men, if I'm not correct. And the reform interjects more balance of male and female than currently might exist. Is that correct?
I'd have to check, Ken. I thought that there were gender requirements already.
And I will speak to that too, Ken. I'll need to check on that as well. I'd be all for more women on there. I think that it's really helped our House this year with the new freshman membership that we've brought in. Our caucus has more female than male on it now. And it's really helped the conversation that we have. And I think the reason why you haven't seen it come up in the House yet is because this is a tough issue. To the point you're making about Democrats getting selected, it's not from the governor's side. Because a governor, so that's what my fear is. My fear is going to swing too far to the right and too far to the left, and it's going to be a pendulum. So not very often do I tell people how, in case something comes up and I vote differently, but I want it to be known that I'm against this and would vote no in the House.
So you're saying that it's okay You're saying that from your position, it's okay that of the attorneys, that well over 70% of them are always Democrats. That's fair. Is that correct?
No, I mean, I don't want to make this to where it's about Democrat, Republican. And I think that we do have a good judicial system today in the state. And that my fear in changing it, it's going to get worse. That's my fear.
Good morning, Bob Forte, relatively new resident in Clive. Glad to hear about the legislature looking at providing resources for the children's mental health issue, which a lot of us are aware of, some more than others. I think that Iowa, like a lot of other states, is in a reactive mode. I think as these problems became more prevalent, not just with children, but the other half of this question is, what about adult mental health, and how do we help them as well? Kind of like the opioid crisis, but I won't go there yet. And it's hard because Representative Judge talked about having to balance the budget and that people don't want to pay more money for more programs for more people, but you stated that it's hard to get mental health providers in the state of Iowa. And mental health facilities have been closed down over the last few years from prior administrations. My comment is we're paying for these issues right now. We're paying for these issues today and will continue to pay. And if the economy is growing at 1.9%, revenues are not adequate to fund programs, we're in a reactive mode. And my ask is that the legislature continues to look at not just children's mental health, which is super important because healthy children become healthy adults, hopefully, but adult mental health, because right now, in terms of absenteeism, reduced production at the workplace, they're not generating the assets and the revenues this state needs to fund the programs. So until we have a proactive plan, and hopefully we have that kind of plan in the future or starting now, we're not going to have the revenue and the returns because we're dealing with mental health issues that reduce all that and increase costs across the board for everybody in terms of health insurance, lost revenues due to people not being at work and things like that. So that's my ask, is that you all continue to be hopefully more proactive and look at these issues. And again, you don't want to pay for it, but we are paying for it now and we'll continue to pay unless something changes.
Yeah, thanks, Bob. We took a big step toward helping our adult mental health system last year. We passed a comprehensive adult mental health bill that works with the different mental health regions that are set up across the state. And we've got a good network in place now for providing services. Flora Schmidt behind you can tell you a lot more about that. That's one of her areas of expertise. So yeah, we do need to continue to always try and find ways to make it better. And I know one of the issues that many of the regions are facing right now is funding, because regions are grouped together. Mental health is funded with property taxes, and different counties have different mental health levies. And we need to try and find a way to equalize funding for mental health among the different counties, or potentially shift it from property tax funding to general fund funding, which would mean that the state would pay for mental health services through income and sales tax, as opposed to property tax owners paying through their property taxes, or some combination of the two.
Yeah, good question. I do think this is a bipartisan issue. From my standpoint, we're working together very well on this. You know, it's no secret that we have a problem and that we need to address it. And like I said in my opening comments, and sitting on the committee on Health and Human Services, we had an opportunity to learn, have a lot of presenters coming in, and the biggest problem that I saw, or one of the biggest problems I saw, is that we don't have the professionals to deal with mental health. And so so if we're training psychiatrists at DMU every year, and pretty soon that's 4, 8, 12, 16. It's going to take time to get us where we need to be, but I believe that we'll get there. And I also think, you know, you talk about money and where does it go. Sometimes we have to set the priorities where you spend your money. So, and we have to make sure in the budget we passed, you know, for the most part it is good. But I think sometimes you have to take the budget and look at it what's most important. I do believe that, as you said, we are spending money today. If you look at our county jails, that's where we're housing a lot of our mental health patients at, and we need to get better. And I'll work to do that along with Charles, I know. So appreciate the question.
Hi, good morning. I'm Jen Kivlin, and I'm with, I work for Holmes Murphy, headquartered just down the street here in Waukee. And we work with employers across the entire state in designing their employee benefits programs. And this is specific around the legislation that's out there that's been debated around mandating that rebates get passed down to the consumer at point of sale. Yeah. And while on one side I understand that could benefit a lot of end consumers and reduce their prescription drug costs, on the flip side it would likely increase the cost for most premiums on employer health plans. So I was wondering if you could speak to an update around that legislation that's out there.
I know where that is in the Senate. It's gone through committee, so I think it's eligible for debate in the floor. And we're having a lot of conversation about the issue you just talked about, that component of the bill. What I'm being told from different employers and underwriters is exactly what you told me, that passing the rebate on directly to the consumers will actually end up increasing the cost of health care because rather than the rebates going to the insurer, who can spread it among everyone, they only go toward individuals, so they're not able to spread those costs around evenly. So right now, I think there are just too many questions about the bill in order to move it through with that provision in there, personally. And I think that's where a lot of people are on both sides of the aisle on the issue.
And I also think one of the key issues that we have around that is that typically rebates are associated with the very expensive drugs, and therefore passing on rebates will make more expensive drugs cheaper than a generic drug in which they would not get a rebate. And so therefore it's encouraging people to navigate more towards the more expensive drugs when there is a more effective, possibly cheaper generic drug available. So I think that's a big issue that we have as well.
Thank you.
And I'll answer that. We did pass that out of committee in the House, a prescription drug rebate, right?
Yeah.
Right, okay. I wanted to make sure I was talking about the right thing. And we looked at it as, and it's, I need to see if it's on a debate calendar yet, but the points that were brought up to me, and I'm glad you brought your points up because I really hadn't heard that side of it yet. But the points that were brought up to me was if you're diabetic, you have insulin, there's a lot of poor people or less fortunate people can't afford to buy insulin and they go without it. So a rebate would help them. And that was the reason it passed out of or that's the reason it did not pass out of committee. I did vote for it though. I do want to make sure I'm honest with you. And that's the reason why I did.
Okay, next question.
Where does the bill, David Leonard, Waukee, where does the bill to enhance penalties for animal cruelty stand now?
Yeah, that bill passed the House by a wide and very bipartisan margin. Wasn't it like 95-2?
Yeah, it was. I think it was 2 or 3 that did not vote for it. Yes.
And it made it through the Senate Judiciary Committee, so it's still alive. This is a big priority for me. I would like us to see something done on this issue this year. And I think we will see something. We haven't caucused on the House bill yet, so I don't know how different people feel about it. But I want to get something done on it. It's an issue that's been batted around for a long time. The stars are aligning. All the different interest groups were, I think, in favor of the bill that passed out of the House. So I'd like us to see it get done in the Senate.
So, David, I do think that's a good bill, and what really I think will help it in the state is it takes agriculture out. And that's not saying what we're for abusing animals at agriculture. But I think sometimes any bill that's tied to agricultural animals, we have to be very, very careful because there's a lot of people out there that are doing the right thing. So I do believe that, it did get support in the House. I supported it. I emailed over 300 people in my district that have emailed me when it passed, and it's probably one of the hottest issues in my year as far as communication from constituents. And I'll end
Me
with,
too. Yeah.
you see the same thing.
Oh, yeah, yeah.
So I do believe we need to get it done. You hear more and more about it, and I can't speak for the Senate, but I think it's very important that we keep striving to get this thing done because the citizens want it. We're not, we need to be protecting our pets.
Good morning, Anthony Pudlow. Work with the Iowa Pharmacy Association, and just want to make a comment to the rebate piece. And I guess really going a couple of years back, I know Senator Schneider very supportive of some legislation that we at the Iowa Pharmacy Association worked to pass to try to bring more transparency to the drug pricing industry, I would say, primarily that being the pharmacy benefit managers. But I think this issue is a much larger issue, a much more national issue. So I encourage all of us, if you haven't already reached out to Senator Grassley, he's been convening several hearings in DC. Recently, he had one with several of the largest pharmaceutical manufacturers, and then this next week, he'll be bringing in the 5 largest pharmacy benefit managers, and really to criticize down to them about how they are, first of all, an unregulated component in the healthcare industry. It's something that we've been at the association really trying to shed some light on and really get down to fair, accurate pricing for medications in this country. So I just encourage all of you, if it is an issue that that all of you have with your medications, definitely please voice your concerns to Senator Grassley right now.
Steve Herwig again. Just an observation, elections have consequences, and to the victors go the spoils, and in election cases, the governor has quite a bit of power in terms of appointments. Certainly on the judicial nomination, the governor makes the ultimate choice. But as an example, I would just point out the Board of Regents, which the members are appointed for 6-year terms by the governor, and the rules state that no more than 5 members can be of one gender or political party. So the current constitution of the Iowa Board of Regents is 5 Republicans, 1 Democrat, and 3 independents. So there's ways around. It's not necessarily a party parity when you think about it. That's the current constitution of the Iowa Board of Regents appointed by the governor. Just an observation. Thank you.
Thank you.
Good morning. My name is Laura, West Des Moines, and I don't mean no disrespect to my neighbor behind me. I didn't know when I was talking this morning that it was hosted by West Bank, because I'm with the University of Iowa Credit Union. But what I wanted to bring up this morning is the issue. We understand that there's legislation that has been introduced from the bankers, and that they're trying to get some legislation passed with taxing on credit unions. Right now, the banks still control 95% of commercial loans in the state of Iowa, as well as 85% of the total deposits in the state. Last year, they had record profits of over $1 billion. And all we're asking is that we continue to have we continue to hold our place in Iowa, and there's a lot of Iowans that we are able to help with that, and we're just asking that you support the credit unions when and if that bill is introduced.
Yeah, we don't have a bill in the Senate on that issue right now. It's in the House. I don't know if they'll send something over or not, but I'm certainly open to feedback from all sides if it comes over.
Yeah, there is a bill that I hear, it was a big topic last week on the House side. There is a bill that's, I have not seen it. It's not been, I have some rumors what the bill says, and it's very complex. So I'm not making a determination on it yet because I haven't seen the language. And I believe that it's going to be a pretty heated discussion, would be my guess, because there's a lot of people on both sides. I've heard from a lot of people already. I mean, there's TV commercials playing, so we have to get the facts right and make sure that we're doing the best for Iowans. And, we'll just see how it goes coming up in the House. But make sure you get with us. If you see that bill, you should let us both know how you feel. Because just so you know, especially on me being there, anytime a constituent talks to me, I'm listening. Because every 2 years, the system is set up correctly that you have to get reelected. So if you're not listening to your constituents, then you're not doing your job. So please reach out if you see that bill, and I'd love to meet with you at the Capitol, whatever you want to do, coffee, but to understand your position more.
Bob Kloss, Clive, as long as we have a Republican governor, are we irreversibly committed to private management of Medicaid? Do you think there's anything that could happen that would change the governor's thought process on, whoops, maybe we made a mistake?
She has admitted that mistakes were made in the implementation of the managed care program. And she has also stated that she is convinced it's still the right way to go. And she's taken some steps that I think will make the system better. She replaced the old actuary with a new one. I think the new DHS director, Jerry Foxhoven, is a good person and knows the system well and is making good decisions. And she told United Healthcare that they weren't going to be a part of the system when they said they didn't want to be held to some of the same standards that the other players in managed care were going to be held to, and that they wanted a guaranteed profit. She told them to go. So I think she's committed to it. We want to make sure that it's working well in the legislature. People on both sides do, because we want to make sure that people who need the help are getting it. And we're ready to take legislative action if we need to make it better.
And I agree with you. It should be a bipartisan issue, and it is. To me, and this is just my opinion, that we do need to look through the lens, are we taking care of everybody? And it'd be my opinion, if we could ever get to the point of carving out long-term care, people that don't need managed care, that we can bring part of that back to the state. Now, I don't know if that's ever going to happen. I do believe people on both sides do want to make it better. I've never talked to anybody down there that don't want to improve the process. And I'm speaking from my opinion, it doesn't make any sense to have somebody that's in long-term care being managed by somebody in managed care. And because you're putting them to a profit-based insurance company. And we need to take care of the most vulnerable people. That being said, I'm willing to work with Republicans, Democrats alike. If we're going to keep it privatized, then let's make it better. Let's make it better for the people. So I don't think this is an issue, Republican versus Democrat. I do think it's an issue of trying to make things better.
By way of follow-up, did I get it right? Are other states having the same kinds of problems that Iowa is having? I mean, two major carriers, I think at least two major carriers, in a spat with the state of Iowa and leaving or, thrown out, whichever way you look at it. Are other states experiencing the same thing that Iowa is going through?
I don't know what the implementation was like in other states, Bob. To be honest with you, I do know that 40 other states had already implemented managed care before Iowa did. So it's something that is, the trend is toward managed care among states. And the fact of the matter is the rollout here did not go well. It did not go smoothly, and we need to continue to make it better and do what we can until it works.
I don't know the answer to that question, how other states, I have not studied that, so.
Any other questions? Okay, we do.
Sherry Martinez. I live in Clive, but I'm a Waukee Community Schools parent. And I was curious about the SAVE bill, how that's going. I heard that it passed out of the House and it's in committee in the Senate. So I'm curious how that is going and how that looks for passing this year.
Yeah, thanks, Sherry. I think we're going to pass the SAVE extension this year. I can't remember if it's passed out of committee in Ways and Means yet in the Senate or not, but we need to get that done this year, and I see it getting done this year.
Any other questions today? Any other comments from our legislators? Okay.
Just thank you all for coming out, and like Kenan said, please do stay in touch with us. Let us know how you're feeling about bills or legislation. If you come to the Capitol, feel free to visit with both of us if you want at the same time. I think Ken and I have been working really well together, and look forward to continuing that relationship and doing what I can to represent you all as best I can.
Yeah, thank you. I do appreciate all three of these forums that you've had. And I'll end with, Senator Schneider and I may not agree on everything, but, I know for a fact he's willing to listen to me, and I'm willing to listen to him, and I think that's what you want out of a legislator. I do think it's best when, and this is just my opinion, when things are more even. In the House, it's House side, when you have people that have to give and take to get bills passed, things work best for Iowans. So that's just a little testament that I think, and even with if you get too big a divide, bills run through there pretty quickly. And we have to make sure that all voices are being heard. And I do believe that it's about the people. It's not about making sure we're taking care of our constituents. And that's how it's set up, and it works. So reach out to me anytime, and we'll get back to you.
Thank you.
On behalf of the Waukee Area Chamber of Commerce, thank you to our State Senator Charles Schneider and Representative Kenan Judge for joining us today and for the other 2 legislative coffees. If you're interested, the Chamber of Commerce is actually going for Day on the Hill with the Greater Des Moines Partnership and the 24 affiliate chambers of the Des Moines Metro on Wednesday for Day on the Hill. I know the governor will be speaking and several other guests, but it's a really neat breakfast. I think it's at 7 a.m. This Wednesday, April 10th. So feel free to join us for that. Thank you all so much. Hope you have a great week ahead, and we'll see you soon. Thanks.